What's up, guys? Bob with Refuge here, and today we're going to talk about nasopharyngeal airways. And to do that, we have Phelps, who is our Director of Operations for Refuge Training, and we have Heath, who is our guinea pig. So Heath's going to get a naso put in, and it's a little bigger than you think it is. So Phelps, if you could, just talk us through what you're going to do here.
Sit down. Obviously, they can be in any direction, but you're going to open this up. You're going to keep the bevel towards the septum. You're going to tilt his head back, kind of like you would do a recovered position, head tilt, chin lift type feel. You're going to take the tip of his nose and lift it. And if he's conscious, you're going to tell him swallow over and over again. Swallow repeatedly as I insert this. That will help it go down. If they're unconscious, obviously they're not going to respond to that. So take this loop packet out and tear down one side.
She's a fighter. Just use your teeth. It doesn't need to be sanitary.
Yeah. Oh yeah, because I'm just going to stick that kind of stuff in my mouth. No. So one method you can do is just put it all in your palm. Run it around like so. That way you still have more if you need to try this on the other nostril. So, are you right-handed?
Yes.
Okay, so you want to use their dominant nostril, which is their right nostril if they're right-handed, left nostril if they're left-handed. If they're unconscious, you won't know. But if they're wearing a pistol on their left side, or something like that, can be an indicator. So I'm going to lift your nostril up, bevel towards the septum, and you are going to begin swallowing over and over, repeatedly. Swallow, 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 swallow. And then, if this was for actual medical care, we would tape this in place because if he's conscious and when he speaks, his tongue will move. And go ahead and tell him what that's like.
It's not pleasant.
Typically, this will get pushed by the tongue and actually come out. See, just like that. So, go ahead and pull that out yourself. The important thing is not to go too fast. It's a very strange sensation. It can become overwhelming if you go too fast. But also don't go too slow, because then it becomes very tedious and drawn out, and that can just grate on someone. And both of those situations may result in reactions you may not be ready to handle.
So, if you want to learn this hands-on, if you actually want to get some training, where would be the best place to figure that info out?
So, there's a difference between instruction, like this, and training. Training is hands-on, and in our level 2 responder class, we actually walk a student through applying this.
Awesome.
To either an instructor or another student.
So this isn't training right here. This
No,
isn't
this
us
is
telling you to do this.
Instruction. It's
This is
different.
instruction. This is information. A little bit of entertainment here, as Heath took it just like
was
a
a good
champ.
sport.
Yeah, he was great. So check us out here, Refuge Training, Refuge Medical. Get the stuff you need, get the training for it, and we'll see you guys next time. Remember, carry an F and tourniquet.
Stay blessed.